Radiation therapy. Radiation therapy, also known as radiotherapy, involves the use of high-energy rays or particles to target and damage cancer cells. It is typically delivered externally through a machine called a linear accelerator. The goal of radiation therapy is to damage the DNA within cancer cells, impair their ability to multiply, and induce cell death. In mesothelioma, radiation therapy is commonly used as a palliative treatment to relieve symptoms such as pain and difficulty breathing. It can also be employed after surgery to target any remaining cancer cells in the affected area, reducing the risk of local recurrence. In some cases, radiation therapy may be used as a definitive treatment for patients who are not candidates for surgery. However, radiation therapy for mesothelioma is often limited due to the proximity of critical organs, such as the lungs and heart, which can be sensitive to radiation. Immunotherapy. Immunotherapy has emerged as a promising treatment option for various types of cancer, including mesothelioma. It utilizes the body's own immune system to recognize and target cancer cells more effectively. Two notable immunotherapy approaches being explored for mesothelioma treatment are immune checkpoint inhibitors and adoptive cell therapy. Immune checkpoint inhibitors. Immune checkpoint inhibitors are a class of drugs that work by blocking certain molecules on immune cells or cancer cells, which act as checkpoints to regulate the immune response. By blocking these checkpoints, these drugs help release the brakes on the immune system, enabling it to mount a stronger attack against cancer cells. For mesothelioma, immune checkpoint inhibitors target specific molecules, such as programmed death ligand, PD-L1A, and deprogrammed cell death protein, PD, which are involved in inhibiting immune responses by blocking the interaction between these molecules. Immune checkpoint inhibitors enhance the immune system's ability to recognize and attack mesothelioma cells. Clinical trials investigating immune checkpoint inhibitors in mesothelioma have shown promising results, with some patients experiencing prolonged disease control and improved survival rates. Adoptive cell therapy. Adoptive cell therapy is a personalized form of immunotherapy that involves extracting immune cells, such as T cells, from the patient's body and genetically modifying or enhancing them in the laboratory. These modified T cells are then reinfused into the patient, where they can better recognize and attack cancer cells. Chimeric antigen receptor (CAR-T) cell. The RP is a specific type of adoptive cell therapy that has shown remarkable success in treating certain blood cancers. In CAR-T cell therapy, T cells are engineered to express a chimeric antigen receptor, which allows them to recognize a specific antigen in cancer cells. While CAR-T cell therapy is more commonly used in blood cancers, researchers are actively exploring its potential application in solid tumors like mesothelioma. Development of CAR-T cell therapy and other adoptive cell therapy approaches for mesothelioma is still in the early stages, and clinical trials are underway to assess their safety and effectiveness. Immunotherapy offers an hope for patients with mesothelioma, particularly for those who have not responded well to conventional treatments. However, it's important to note that not all patients may benefit from immunotherapy, and the response to these treatments can vary among individuals as research in immunotherapy continues to progress. Ongoing clinical trials are critical to refining and optimizing these innovative treatment approaches for mesothelioma and other types of cancer. Mesothelioma diagnosis. Coping with a mesothelioma diagnosis, support and resources. Emotional support. A mesothelioma diagnosis can be emotionally overwhelming for patients and their families. Support groups, counseling, and therapy can provide a safe space for individuals to express their feelings and receive guidance on coping strategies. Support groups. Support groups are valuable resources for patients and their families as they provide a safe and understanding environment to share experiences, emotions, and challenges related to mesothelioma. These groups often consist of individuals who are going rough similar situations, creating a sense of camaraderie and solidarity. In support groups, participants can freely express their feelings, fears, and triumphs, knowing they are among those who truly understand what they are going through. Counseling and the rupee. Professional counseling and therapy can be beneficial for individuals struggling to cope with the emotional impact of a mesothelioma diagnosis. Therapists or counselors with experience in working with cancer patients can offer personalized guidance, coping strategies, and emotional support. They can help patients and their families navigate the complex emotions, fears, and uncertainties that come with a serious illness.